Good afternoon. I'm Jana Martin, Chief Executive Officer of the American Insurance Trust, known to most of you simply as the Trust. We're delighted that you're able to join us today for this important and timely webinar series, Turning Toward Ourselves and Each Other, the Pivotal Nature of Clinician Self-Care. Part 1 is titled Understanding the Stakes and Recognizing the Terrain. Today's webinar is being presented by Dr. Liesl Bryant. Some of you may know Dr. Bryant as a risk management consultant for the Trust Advocate 800 program. In the interest of time, we've placed her bio on the slide for you. We're very fortunate to have her with us today. Let's begin our 3 hours together with Dr. Bryant as she helps us with better self-care. I know you will benefit from this. Please join me in welcoming Dr. Liesl Bryant. Liesl?
Hi, great. Thank you, Jana, and welcome to all of you. I'm very happy, very excited to be here with you today, and also just to be talking about this topic, which is so essential to obviously our profession and the work that we do, and certainly in the times right now, right? The times we're living in, it's sort of all the more important. So a couple of quick sort of logistics in terms of how this will go. We're actually going to take a break roughly every hour. This is, of course, a webinar on self-care. So as we go through the material, we are going to practice self-care. So we're not going to stare at our screens nonstop for 3 hours. We will take breaks roughly each hour, and they'll be for about 7 minutes so that we have, enough time to sort of just take a break, get up, and then come back. I also want to let you know there will be a couple of times, or maybe just one time, where I'm going to be asking you all to respond to some questions on my end that I'm going to pose to you. And so you'll be able to write those into the Q&A box, not into the chat box, because the chat, of course, as Jana said, is disabled, but you can communicate to me directly into the Q&A box. And in addition to that, in terms of your questions, I will be taking questions from you all live today. By and large, we're going to leave those until the very end. So I have left some time at the end of the presentation to cover those. You are welcome during the presentation as we're going through. You're welcome to go ahead and write those into the Q&A box. But for the most part, I'm not going to be addressing them as we go, primarily just because we have so much material to get through. And I do want to make sure we can do that. And then when we get to the question section, of course, I will do my very best to get through as many of the questions as possible. There are many, many more of you than me, and we may not have time, or most likely won't have time to get to all of them, but we will certainly do our best. So with that being said, we're going to go ahead and dive in. Of course, as Jana mentioned, this is a two-part series, and today we're really focusing on understanding the stakes of self-care and recognizing the terrain. And so we're going to look at, of course, we're going to look at a lot at what is self-care? How do we define it? What does it look like? We are certainly going to spend time identifying the really critical connection between self-care and our ethical duties and responsibilities, our issues of competence, competence to do the work we do, and then of course, clinical effectiveness, because there's a really intimate link there that's really important. We're also then going to look at what are the risks, certainly more than 5, but talking about what are the risks if we don't appropriately attend to our self-care. Where does that land us? And then we're going to look more specifically at the terrain of what happens when we're not doing good self-care, and in particular at distress, burnout, compassion fatigue, and vicarious traumatization. And mostly there, we're going to go into some of the details. Unfortunately, not as much depth as might be useful just given our 3-hour time limit, but we're going to go into as much as we can, mostly so that we can start to look at and see, okay, what does this look like? And how do I know if I'm experiencing one of these conditions, those kinds of things, so that we can start to catch it and then be able to respond. We're going to look at a continuum and see where sort of self-care lies on that. There's some And then we're also at the end, we're going to talk about various pathways toward improving clinician well-being. We're not going to go into great detail on that because we're going to do most of that in part 2. And I'll talk more about what part 2 entails as we get to the very end here. But a lot of that will be also in part 2. But I do want to just start that today. So we're going to do some beginning look at what those pathways are. And all throughout today, we're going to be really talking about and paying attention to how self-care is really an essential risk management strategy. It's so many things, of course, and we'll talk about that, but it's one of the best risk management strategies we can put into place to protect both ourselves and, very importantly, to protect the folks that we work with. So those are our goals, our objectives that we will hopefully get to all of them today. And I want to just start, this is a self-care webinar, so I want to start in part with just a pause. And we're going to do just a very small breathing exercise here. You can choose to close your eyes. You don't have to, whatever's comfortable for you, get in a comfortable position. But I want to just pause for a moment. And so here, if you want to just start by just taking a nice deep inhale, I'm going to do a few deep breaths. The yogis talk about these as 3-part breaths. So you're breathing into your belly, into your ribs, into your chest. You may want to just suspend the breath at the top of the inhale for a brief moment. And then exhale all the breath out. Right? Really exhale fully and completely. And then inhale again. And on this inhale, really sort of, if you gather up all the things you've been worrying about, all the things that have come before this webinar, and then on the exhale, just release that. And on your next inhale, just coming more fully into the moment, into your body, feeling yourself in the chair or the couch. Maybe feeling the floor beneath you, feeling the weight of gravity, the pull of gravity. And then as you continue just to breathe in that space, I invite you just to check in with yourself. How are you feeling? How do you feel emotionally? How do you feel physically? Does your body feel good, tight? What's your energy level like? And then I want you to ask yourself, as you stay in that place, what is needed right now? What do I need right now? And it can be anything. It can be a physical need, an emotional need, any need that comes up, but really tuning in and listening to what is needed in this moment. And then considering, asking yourself also, what action can I take to receive whatever it is that you need? And it may be something you can take right now, like shifting your position in your seat. It may be an action that you'll take later today. What action can you do to actually meet that need that arose? And if it feels right, you can make a commitment to sometime between now and the time you go to bed, actually meeting that need, giving yourself whatever that is, whatever that action is, so that you know you will respond to that need. And then take one more last inhale before we move on. Just inhaling deeply. Peace, calm, relaxation, and exhaling. So I hope you feel a little more centered. I wanted to start with that today because that is actually an example that took us just a couple of moments. It was not very long, and yet that is a powerful technique we can use at any point during our day to already start to attend to our self-care. And it doesn't, a lot of times I hear from people, I don't have time to take care of myself. I don't have time for this, or who can fit that into a very busy schedule? And of course, we all have busy schedules, but this, right, we can do very, very quickly. And yet it does have a profound effect on the body if you really engage it. And the more you practice something like that, it doesn't have to be this explicitly, but something like that, the more you find that you're able to really know what you need and attend to that more rapidly. So we're going to move on now, although I hope you'll be able to maintain that state of hopefully a little more relaxation and just a pause from the busyness of our own days. And I do want to start, we're going to start by looking at some of the recent headlines. What do the headlines tell us about what's happening right now? And some of them are, so for instance, NBC News says therapists are under strain, counseling clients on trauma that they're also experiencing themselves. The Huffington Post says, I'm a therapist and I'm struggling with the COVID pandemic too. The author who wrote that was a therapist. Forbes says, we need to talk about another pandemic, mental health crisis, of therapist burnout. USA Today, mental health professionals are the ones taking care of us, but who is taking care of them? And from Newsweek, we are therapists. After 6 months of lockdown, we're almost at a breaking point. So we see just from some of these headlines, in many ways, how serious some of these issues are. Now, of course, we have all lived through the last year of the pandemic. And I think although many of us had hopes that it might slow down in 2021, as of yet, there doesn't seem to be a lot of evidence that it's in fact slowing down. So we are very familiar with the pressures we've all been living under. But we're really noticing that as the acuity level and demands for our work increases, it is putting a strain on mental health clinicians, right? In the same way it's been putting a strain on our nurses and doctors and medical folks and emergency responders. And so I want to look also briefly, that speaks to, of course, the strain on psychologists in particular. I want to look at for a moment at the APA Stress in America study, which for those of you who may not know, every year APA surveys folks about what kind of stresses they're experiencing, what the level of intensity is, and how people may be responding to the stressors in their lives. And so they've done this study for many, many years. And in 2020, it was done towards the end of 2020. I believe it was August of 2020 when this came out. But what they noted is that 2020, the information in the 2020 survey was different. They found that Americans, of course, were profoundly affected by the COVID-19 pandemic. And what was interesting is that that there was significant stress in the pandemic, but that stress was in addition to all of the more typical significant stressors that had been present for prior years. So it wasn't like it had taken the place of those stressors, it just was an addition to those stressors. And of course, these compounding stressors, as they say, are having real consequences on our minds and bodies. Fully 78% of people said the pandemic was a significant source of stress. 49%, so roughly half, said that it had negatively affected their behavior. And as I said before, it also found that the prior significant stressors that we were all experiencing before the pandemic hit were also continuing at high rates. And fully 60% of the individuals surveyed said that the stress they're experiencing is overwhelming. In addition, 77% were worried about the future of the nation, and that's an increase from 2019. 71% said that they felt like this was the low point in our nation's history, and that's up considerably also from the 56% that said that in 2019. 70% said that family responsibilities were also significant stressors, and that, of course, the school year, 63% said the school year was extremely stressful. So we see a great deal of increase in a lot of areas, certainly given all that we know has been going on with social unrest and police violence. It's not surprising then that almost 60% of adults said that violence towards minority was a major stressor. And that number, though, is significantly higher than the number just in 2016. And lastly, then 33% said that discrimination was a significant stressor, which is also up from last year. And among people of color, that number is even higher. So what we're seeing is that there is obviously a great deal of stress. I want to just quickly point out that they did an additional snapshot in 2021, just at the end of January of 2021. So this is very, very recent. And, you know, again, we might have thought that it would get easier in 2021, but that's not what we're seeing. In fact, it got higher than it was in 2020. So according to these surveys from APA, what they're seeing is that the increase in stress is actually continuing. Fully 84% of adults reported at least one emotion associated with prolonged stress in the prior 2 weeks, just in the 2 weeks prior to the poll being taken. 67% were reported to be overwhelmed. And regardless of political affiliation, the majority of Americans reported emotions associated with stress. So why do I take the time to go through all of that? I do that for two reasons. One, this is what our clients are living in, right? So all of these people, you know, these are the people who come to our offices for assistance. And the level of acuity is very, very high. The intensified anxiety and fear and depression, you know, and many of us are seeing this in our office. So the clients who are now coming to us are the very people who are in fact experiencing these significantly higher levels of stress and all of the outcomes of that, right? In addition, we too are experiencing this. So unlike, you know, prior years where maybe someone had a traumatic experience and they came in for us to help them with it, we too are living right alongside in having our own experiences of the pandemic and trauma. Some of us have lost friends and families. You know, there's a great deal of disruption in our own lives. You know, those of us with children who are trying to juggle work from home and school from home and just life, you know. So it's important, I think, to keep that in mind, because although, of course, self-care has always been essential and will always be essential to the work we do, it's really so important now because the stresses and the strains are so heightened. And because, as we're going to talk in a few minutes, this is really going to have or can potentially have a significant impact on our ability to do our work and to do it well. So I want to start with a very short, very quick exercise. And this is where I'm going to ask you guys to participate for a little bit. And I want just take out a piece of scratch paper there wherever you are. And on that scratch paper, I want you to list 4 stressors that you're encountering in your work. Any 4, whatever 4 come to mind. Just list those out. Oops. And once you get those 4, then you can list as many other ones as come. Sometimes people think that they have to stop, but you don't have to stop. Give you just a minute. And then, if you will, what I want you to do, and you can do this under anonymous, so you don't have to do this under your name, but I actually want you to, if you will, write in 2 or 3 or 4 of your top stressors into the Q&A box. Again, not using your name, you can choose to write it in under anonymous. That's my preference, and just write it in so that we get a sense. You know, we're not in person, I can't ask you to shout them out. So write them in, and we can all sort of get a sense for what we're experiencing. Right, so some are coming in. So high demand for services, absolutely. Fatigue interfering with productivity, yes. Keeping up with paperwork, no breaks or vacations, right? Patients are not keeping appointments, ever-growing wait list, money, technology frustrations. Yep, rescheduling due to various reasons. Teletherapy is a stressor. Billing, screen fatigue, right, which you may be experiencing now too. Tech problems, report writing, virtual work. Yes, suicidal clients over telehealth, money again. Returning referrals, multiple clients in crisis, screen fatigue. Yeah, these, I'm not going to read all of them. Oh, interesting. People wanting me to fix things I can't fix, a sense of urgency to get things done. I encourage you to keep reading some of these. I'm going to move on for the sake of time, but what's important to notice, and I think we can already see this, you know, is that there's some repeating themes, right? About the balance, the workload, increased workload, the crisis and acuity of clients, teletherapy, money, financial strains, deadlines. You know, we start to see that there's multiple themes here. And the main thing that I want you to, well, 2 main things that I want you to sort of notice from this. One is just to start to be aware of what are the stressors for you and for all of us, of course, but what is particularly most stressful for you. And 2, in looking at this Q&A box, you know, there's many responses. Hopefully you can see really clearly that we're not alone, right? We're not alone in experiencing these stressors. Sometimes, especially when we're isolated, which many of us are much more isolated now during the pandemic than before, it can feel like we're alone. It can feel like we're the only ones that are bothered by things or the only ones that are feeling overwhelmed. But if you notice, so many of your colleagues have written in, you're far from alone. And I'm sure that this barely scratches the surface, right? This is just a very quick overview. So I also am going to have you, now this one we're not going to write in on, but this is just for you to sort of notice some of these things. I want you to take a look at these 2 lists and just spend a minute and read through them. Again, we're not writing this into the Q&A. This is just for you to think about as we go through here. But I want you to notice how many of these experiences you may have experienced, or perhaps you have colleagues that you know have experienced them. Because partly we're going to be talking today too about keeping an eye on each other, right? The title is Turning Toward Ourselves and Each Other. But taking a moment to really feel into if any of these events or experiences have occurred. And the reason I put this up and do this is because, and many of you probably know this, but these are symptoms of what's sometimes called secondary traumatic stress or chronic fatigue. There's different terms and usages of that, and we're going to get into some of the distinctions later. But what's important to keep in mind is that in many regards, some of these symptoms or many of these symptoms are not something that can be avoided. They're actually something that is part of our work, right? We experience them because there's something that happens when we or someone works a lot with traumatized individuals or individuals who are experiencing extremely challenging emotions. And of course, you know, we're not alone in experiencing that. I also want to look at a couple of misconceptions because I think these get in our way and actually make it harder for us to do the real work of self-care. And one of those is this idea that nobody else is stressed or impacted by their work. And again, it's harder for us to sort of blow this belief away if we're isolated, so that we can sort of start to buy into this when we're so isolated. Also is the idea it's a part of the job, I just need to push through it or forget about it. You know, I think so often people will see that symptom list before and they think, yep, this is just part of my work, I have to deal with that, I just have to keep pushing through. We're going to later look at symptoms of burnout, and instead of seeing them as warning signs, so often we just keep pushing, and that's part of the problem, of course. This idea, if I let others know how stressed I am, or that I'm experiencing symptoms of burnout, compassion fatigue, or vicarious traumatization, they will question my competence to do my work. So even within our own field, there's a kind of stigma and some shame and a desire to keep it hidden for fear of the repercussions. And that is dangerous, and hopefully something that we over time can change in our field. Also the idea I should be able to handle this, you know, and the question of what's wrong with me that I'm so stressed, overwhelmed, exhausted, or that I don't feel anymore. How is it, what's wrong with me that I sit in session with some people and I just feel nothing? You know, those kinds of symptoms. Or I've just had a few hard cases, this will pass. I don't do anything about it. I don't need to worry about it. All of these misconceptions actually perpetuate the very problem. They will simply keep us stuck. So looking then at some of the truths, of course, you are not alone. As we've just seen from our Q&A, right? None of us are alone. We're all experiencing this. Everybody is dealing with multiple stressors, and many of us at present are burnt out and possibly experiencing symptoms of compassion fatigue or vicarious trauma. Especially over the last year, you can hardly be human and not have experienced some of those symptoms or sort of work-related conditions along the way. Now, hopefully we're not staying in that place, but given our higher workloads and all of the things that you guys pointed out in the Q&A, you know, we are human, they're going to impact us, and this is in fact how they're going to impact us. We also want to keep in mind that stress is not something that can be avoided. And in many regards, right, we don't even want to avoid all stress. You know, there is some stress that's actually good stress for us. And there's a lot of research behind that, you know, good stress can actually be positive for us. It can fuel us, empower us to do things and stretch further and achieve more. But there is quote unquote bad stress or negative stress. And if we continue in states of stress for too long, it will take a very serious toll on our bodies, on our physicality. We know that a lot of medical issues can develop from being overstressed and overworked, and certainly on our psyches and our hearts and our emotions. This is really important to remember in terms of a truth and sort of combating those misconceptions, is that you are not doing anything wrong if you're experiencing these symptoms. It's not your fault. It's just by virtue of being a human being, and being a human being who is in a care-intensive field, right? As we're going to look and see a little bit as we go through today, the work we do is care-intensive. That is the nature of our work. And so as a result, we are frequently giving of ourselves. It's not that we're doing something wrong or that it's our fault. It is our responsibility, though, to pay attention and to manage any potential symptoms or issues that arrive, right? And make sure we don't get to these states of burnout or extreme burnout and impairment that we're going to talk about a little bit later. As I said, you know, we can't expect to do the work that we do and not experience some form of stress. And we're going to look a little more as to why that is. And we're not stressed because we're weak. We're not overwhelmed or burned out because we're weak. It's because of the kind of work we do. You know, we're not sitting As accountants with numbers all day, we are working with people. And right now we are working with people who are experiencing extreme levels of distress and disruption in their life. And alongside them, we are experiencing distress and disruption in our own lives. And so we're sort of getting it from all angles. But I do, these are really important things to really take in and remember. Also, this is from Aubrey and Gentry. They say the inability for professionals to recognize, accept, and the fact that we are wounded by our work, sometimes, not always, but sometimes, is due to a lack of understanding that these symptoms are normal. And so here they're getting at, again, this hesitant to sort of acknowledge that sometimes our work is hard or wounding, or in some instances harmful for us. We too can develop symptoms. Also, the misconceptions, as I've mentioned, about our own vulnerability to these stressors prevent the very things that we need in order to restore our own self-care and to create greater self-sustainability. So these things do actually stand in our way. From William Steele, stress alters the way we think and process information and subsequently how we behave. And there can be this sort of negative or vicious cycle that begins. And the more we buy into these misconceptions, the less attention we pay to our own experiences and how we're feeling and thinking. And then that just makes it worse, right? This vicious cycle of increased symptoms, possibly greater isolation. Now, a lot of us are experiencing that just because of the pandemic. But then this makes it really that fertile breeding ground for falling or moving down the continuum. And we're going to talk about a continuum in a little bit, that ultimately will end in impaired behavior and significant harm for our clients. And that's the real, one of the real tragedies. Again, Aubrey and Gentry, to recognize, accept, and acknowledge the problem is when real healing and resilience begins. And so my hope is a little bit by doing this webinar today, and then also part 2, if you choose to attend that maybe we're starting to do that healing a bit. And that this can be a place where we start to turn toward ourselves and as well as each other. So we're going to look in a moment about a lot of the hazards of our work and some of the difficulties, many of the difficulties that we're facing and experiencing. And before we do that, I want to start first with a very quick look at the rewards of practice. And you might think, why are we doing that in a self-care webinar? And the reason is because actually paying attention to and looking at the rewards of practice can be a way to nourish ourselves. Right? I mean, yes, there's lots of challenges in the work that we do, and there's lots of really incredible rewards and meaning. It is a profound honor to work with people to help facilitate their growth and their change. And so we don't want to leave that by the wayside, so to speak. So it's helpful to remember these things and to really pull them into the forefront, especially when we're experiencing some of the more difficult aspects of our jobs. And this list comes from Norcross and Guy. And there's various ones. I'm not going to go into great detail here, but just to remind us of, again, the satisfaction of helping, that place that we hold, the permanent place of membership in our client's world, right? What a place of honor that is. Not many people, in other professions get to say they hold that place. There's various other options. Those are the rewards at the office, like within our work. There's also rewards out of the office, because the work we do actually can lead to our own growth. It can improve our own relationships and personal effectiveness. It gives us meaning in the life that we do. And so it's important that we remember this and that we really hold on to it and allow it to nourish ourselves. I want to look just for a moment at this research study done by Radecki and Mahoney, and they were comparing the fields of research psychology to psychotherapist, and discovered that therapists were rated significantly higher on multiple dimensions. And again, I'm not going to spend a lot of time here, but I do want to just point this out, again, looking at what are the rewards of, in this case, being a psychotherapist, made me a better person, made me wiser, increased self-awareness, appreciation for human relationships, increased tolerance for ambiguity, and so on. So these, of course, are extremely valuable things, and it can be very useful, especially when you're in the middle of some very difficult times, to really pull these back and to remember them. And I'm gonna, as we go through, I'm gonna ask sort of 3 inquiries that you can maybe hold in your own mind as we move through the material here. And the first is, what are your sort of joy of practice experiences, right? What are those experiences where you just, when you remember them and recall them, you know you did a great job, you know you made a really significant impact in that other person's life, whatever that was. Maybe it was a child, maybe it was a parent, whoever it was, that you know you had an effect and you know that it was powerful. Those kinds of practices and those moments, those joy of practice moments, help us remember the rewards. And so that is one very tiny technique, but also very easy to remind ourselves, and again, help with that sort of nourishing self-sustainability. It can revitalize us to remember those moments. Those moments can keep us going. Second inquiry, and I hope you'll really ask this, not only today, but going forward, where do you hold and nurture your own self-sustainability and self-care? What is it that you're already doing and maybe doing quite well that sort of allows you to tune into this and to really nurture yourself in terms of self-sustainability and self-care? What is it that maybe needs strengthening? Maybe you're doing it a little bit, but you think, oh, if I could just add to that a tiny bit, I know it would help. And lastly, what is it that maybe needs creating? Maybe you're not doing it at all, but maybe something new and different is really called for. And I think staying in inquiry around those questions is really helpful, especially now, because as we'll see, and we'll talk more about, our self-care needs change, and they change, of course, over the course of our career. When we're early career folks or students, we have very different self-care needs than when we're middle career, end of our career. But they also change day to day, and they change in part based on also what's going on in the world around us. Certainly, I think a lot of our self-care needs right now, in the middle of a pandemic that's been going on for a very long time, are different than they were, say, 2 years ago at this same time. And then the last inquiry really is, what are your personal barriers to self-care? We'll talk some more about that in the second part, but I wanted to go ahead and have you start to think about that now, because again, anything that's standing in the way of your tending to your self-care is actually standing in the way of you helping your clients more. So there's a reciprocity there. Okay, so why self-care in the first place? Why are we spending so much time on this? Well, of course, in our work, there is an intense giving of ourselves in order to enhance the life of our clients, right? And in that regard, this giving of ourselves is actually one of the requirements of the work that we do. So, there's the metaphor of the psychologist as the instrument, right? We see violins here. And for any of you who, know a musician, of course, they take their instruments very seriously, because that is the mechanism by which they do their craft, right? For us, we are the instrument. We are the method of change, and we are sort of how we facilitate that change, our own self in many respects. And so, as we know too, there's a lot of research out there that talks about the primary benefit of our work that we do with folks derives from the relationship intense work of the alliance, right? There's a lot of research that shows that it's the treatment alliance, regardless of modality, regardless of orientation. It's really that alliance, that relationship, that is the mechanism for change, that allows people to connect and do what they need to do in order to make change. But what that also means is that it's very care intensive for us, right? Oops, sorry, I just want to go back here for a sec. So it's care intensive. And if you think about the musician, right, let's say the violinist to match the picture, violinist or any musician is going to be very protective of their instrument. If you think about it, right, they have cases, they're usually very expensive cases to protect it. They think about what temperature is it in. They're very cautious who they allow to hold and touch and manage their instrument. They spend a lot of time tuning it, making sure it's exactly in the right tune. And in that regard, we want to be doing the same thing with our instrument, which is ourself. So that is, of course, why we're looking so much at self-care and how, what that means and how we can do it. So what is self-care? Well, there's a couple of different ways to think about it. One, it is self-initiated by and large, although we're also going to talk about, community support and assistance. But really, self-care is a practice, and it's taking an active role in protecting one's well-being and happiness. It's also a kind of tending to ourselves and does require that we get to know ourselves, right? We can't address and give to our needs. We can't respond to our needs if we don't know what they are. So we have to get to know ourselves in the same way that we get to know our clients, and we typically respond to their needs if it's appropriate. Certainly there's a quality to self-care, and we'll talk more about this too, of being aware and also of honoring one's needs. So that's the being aware, noticing, knowing what's going on, but the honoring is where we actually then respond to that need, where we actually then take that next step and do something to tend to it. There's a sense of sort of mindfully paying attention to and caring for ourselves. And of course, there's also this deliberate acting and to promote our well-being in multiple directions, right? Physical, mental, emotional, psychological, and spiritual. Because self-care is not one of that. Self-care is the whole piece. In our work, and to some extent in our lives, but just focusing on our work, there is this sort of constant tension between other care and self-care. It can sometimes feel like this teeter-totter, right? In our work, we see a great deal of human suffering, and sometimes we're having to give more. Sometimes we also need to pull back and either withhold care for others or give more to ourselves. And so there's this sort of balance between that. How much can we give of ourselves before it's too much? How many extra hours can we work overtime, or extra weekends can we put in and do more work before it's too much? And when do we need to start withholding? The level of resilience demanded by the work that we do is very high. And that means that we have to, in addition to all of our other skills, we have to get skilled at building resilience in ourselves. That is a part. In the same way the musician is going to tend and protect that instrument, we need to tend and protect our instrument, which means building resilience. Of course, as we've talked about, our work has this intense focus on the other, right? That so much of what we do in the consulting room has to do with the other person. And that, on the one hand, is, of course, the power of our work. It is what is important, and we have this highly skilled ability to take that other person's perspective and to really help facilitate growth or change or whatever is called for. But if we only focus on the other to the detriment of ourselves, or losing sight of our own needs, then not only are we harming ourselves, but we very likely will end up in a place where we harm the very person that we're setting out to help, which is our client or our patient. And lastly, I want to just point out again, this a colleague of mine referred to it. I think this is such a great phrase, but this idea of a tsunami of need right now. And if you look back at some of the things you guys are writing in the Q&A, many of you wrote about that, right? Caseload. I talk with a lot of clinicians. To me, my caseload is full. I have a waiting list, and every clinician I call in my community is full with a waiting list. So I don't know where to send this person who just called me. I really want to help them, but I don't know what to do, right? There is a tsunami of need right now. And I think it's important to call that out and to recognize that, because the answer to that tsunami of need is not that we give and give and give and give and give until we are like, in the ground. because that doesn't help anybody. And people, our clients, our patients can get harmed, and we can harm ourselves as well. So we need to, yes, notice, acknowledge, and tend to that, or pay attention to the tsunami of need. And we're going to have to find this balance. You know, we can't go to one end of the seesaw or the other. This is a quote from Cross Van Boss. I think it's a great quote. Self-care is not a narcissistic luxury to be fulfilled as time permits, which is, I think, sometimes a sort of feeling that so many people have. I'll do it when I get to it. Instead, it is a human requisite. That's pretty powerful. By virtue of being human, we have to engage in this. It is a clinical necessity, and we're going to talk much more about that as we go, and an ethical impairment. So not only is it necessary for us to do good clinical work, but it's also absolutely a mandate by our ethics. It's a responsibility and a duty we have to our clients. Okay, so self-care, Ellen Baker talks about self-care as being comprised of 3 processes. One is self-awareness. You know, we can't start, as we've talked about, we can't start to tend to our needs if we don't know what they are. So self-care absolutely must have a quality of self-awareness. And we will talk more about this. And also in the second section, we'll talk about how do we develop that more. But the second piece then is self-regulation. And this is, you know, certainly this is talked about in dynamic context, behavioral context, but this is where we not only pay attention to and are aware of our own reactions and responses, but we also bring in this self-regulation piece, relaxation, whatever it is where we're moderating, helping to regulate our own impulses. And we, the third piece then is this idea of a balance of connections, and balance of connections, both in terms of a little bit back to that sort of teeter-totter image where we're, as Ellen talks about it, it's really this oscillation and modulation where, you know, between sort of giving and hopefully then receiving or pulling back so that we can receive. And it's a balance of connection both with our clients, because we know there's this dance we do in the consulting room, but also on a larger scope too, you know, in our communities, our professional communities, communities we live in, with our families, and so forth and so on. And it's really, she talks about it as sort of balancing between the extremes, you know, and it's important to remember that whether we call it a balance of connections or this tension between other care and self-care, you know, there will be moments where we're on, if we take that teeter-totter image, we're on more on one end than the other. And that's fine, because life is that is what we're gonna have to be able to do. I tend to prefer to think about this more as like a flow than a balance, because balance is hard to achieve. But flow, if you're flowing in different directions, you know you're gonna flow this way, you're gonna flow that way. But the thing is you never wanna end up, as I mentioned, in the extreme. That's where it's dangerous. Okay. I know we're all familiar with our ethics code, but this is where our ethical obligations and mandates come from. And so what does our code say about self-care? Even though it doesn't use that word in our code, it clearly is referenced. And so from principle A, right, we as psychologists strive to be aware of the possible effect on our own physical and mental health on our ability to help those with whom we work. Standard 2.01, we practice only within the boundaries of our competence. And the reason that's important is because when we neglect our self-care, it can actually lead to impaired competence. And we're going to talk more about that as we go. And then standard 2.03, you know, we undertake efforts to develop and maintain our competence. So that means that we actually have to also take efforts to you know, tend to our own needs so that we don't end up in an impaired position. Standard 2.06, as psychologists, we refrain from initiating activities when we know or should know that there's a substantial likelihood that our personal problems will prevent us from performing our work-related duties in a competent manner. So again, this is very clearly noted in here that we need to be monitoring ourselves, monitoring the level of impact on us that our work is having. And when we do become aware that there's a negative impact, then we take range, obtaining professional consultation or assistance. And sometimes we have to determine when and whether we need to limit, suspend, or actually end our work-related activities, depending on how severe whatever we are experiencing is. And then lastly, of course, but closely related, is of course that we avoid harm to our clients. And that it's really essential that we remember this, because failure to adequately attend to our own psychological well-being and self-care puts us at the very risk for the impaired functioning that is both disallowed by our code and that is very likely to lead to harm of our clients. Also, focus on self-care is going to prevent things like burnout and other things we're going to talk about, as we know. And this really is an ethical mandate. We don't have an option. So when people say, I don't have time for that, actually, we don't have the option to say that we don't have time for that. Our doctors, medical doctors often say, oh, you need to exercise more, make sure you eat this and that. We can choose, I suppose, not to follow those kinds of recommendations, but in the work we do, we really can't ignore self-care. Now, I know it can be challenging because I too have a very busy schedule and I know the pressures we are all under, but what that means is that we have to find ways still to address it within those pressures. We can't just put it on the back burner. And lastly, of course, the ethical responsibility to serve those that we serve, to be informed about the stressors that we face. Again, we have to know what we're facing and attempt to minimize that. This is a quote from Hadler. And the main point I want to make here is, he says, the more I take care of myself, truly do, the more I have for others in the best sense. The more time I spend meditating and doing yoga, the things that really feed me, the better able I am to be with the people in my office. The less self-care I do, the less I have to give. And that's my emphasis, by the way, on the things that really feed me. The reason I emphasize that is because self-care has to be restorative. In our society, there's sort of this big, oh, you go to the spa or you get a massage or I don't know, there's a whole bunch of, take a vacation, go on a cruise, and maybe that's self-care. But if it's not restorative for you, Hadler here speaks of doing meditating and yoga, which of course can be restorative and is restorative for many of us, but for some it isn't. And what we do for self-care actually needs to be nourishing for us and feeding us. We can, and I myself have to admit, I've done this, sit down and binge Netflix or eat ice cream. That stuff, although it can feel good in the moment, it's more sort of numbing or escaping as opposed to actually nurturing and nourishing, right? And so self-care really is about what feeds us, what's going to nourish us so that we restore our vitality. Okay, so I want to move on then to talk a bit about what Scoville and Trotter-Matheson refer to as the cycle of caring. And what this does, I want to really look at why self-care is so critical to the work we do, right? And how it really can lead to problems and impairments in our competence and impair our functioning. Because sometimes that's an issue that folks, the link is not fully clear. So from Scoville and Trotter-Matheson's perspective in this cycle of caring, and as we all know, right, caring is a precondition for the helping relationship to be effective. The work we do can't be effective if, in fact, care is not present. And I want to say too, this cycle of caring, by the way, is not just for psychologists and mental health professionals. This cycle of caring is applicable to any sort of caring profession. So teachers, nurses, clergy, physicians, dentists, law enforcement, all of us, this can, is applicable to. And as we know, right, the ability to care is fundamental to this cycle of caring. And in fact, the premise here is that caring is the essential quality that must be maintained in a relationship intense career, which is what we are in, right? A relationship intense career. The inability to care, then, the opposite of that, of course, is the most dangerous sort of sign of burnout, incompetence, ineffectiveness, and we have to really strongly guard against that. So what then does this cycle of caring look like, right? So in this cycle, they talk about as having 4 phases, and they refer to these phases as being like seasons. Seasons of the year that we sort of go through. And the first phase is the empathic or empathetic attachment phase. And this is where, it's just what it sounds like, where we're connecting with the person who has just come into our office. It's that connecting, attachment, bonding, where we're establishing and creating that strong alliance, which is the very alliance that supports and facilitates the very work that we're doing. So that's the first phase. The second phase then is what they call an active involvement phase. And this is where, we're doing the active work. This is where we're utilizing our skills as psychologists and mental health professionals. And we're doing the actual work of therapy. It's very active. The third phase then is the felt separation phase. And this is where, in essence, we're saying goodbye. Every relationship that we start as a clinician, we know will have an end. And hopefully they come to good ends. We all love the cases where we've worked with a client, they've met all of their goals, it's been very successful, we do our termination process, and we say goodbye. That's the ideal situation. But as we know, of course, there's many other ways that endings happen in the work we do. Sometimes clients just sort of drift away. Other times they leave angry or hurt or wounded by us in some way, and those can be harder. But part of this felt separation phase is also for us a kind of grieving, because there is a kind of loss, even if it's good and the termination is good and we know it's appropriate and it's ready, it's still a goodbye, and there's still some part of loss and grief related to that. And the fourth phase then is what they call the recreation phase. And this recreation phase is really where we are resting and restoring ourselves, revitalizing our own energy. This is also the phase that most clinicians tend to pay the least attention to. It's the phase that quickly gets left out. And the difficulty there, if you think about it, and if we just get rid of the recreation phase, then we're just left with the other 3. And you can see how that is a recipe for burnout, right? If it's just we attach, we do the work, we disconnect, we attach, we do the work, we disconnect, and there's never this time for restoration or restoring our energy, then we are absolutely going to burn out, because we do have limits and we are human, and we have to sort of refill the cup, so to speak, or we're not going to be able to be there for the folks we're working with. Okay. There's also, they talk about this idea of hemorrhaging of the caring self. And this, I think, is a great phrase. It is, in many ways, right, it's a very striking phrase, hemorrhaging of the caring self. And there's a kind of violence in it even, I think. But on one hand, it can be startling, but I think it also readily acknowledges a truth of our experience. And certainly, I think a truth of our experiences over the last year, where there's been so much extra burden and pressure and intensity and overwhelm. And the way they talk about this is that, the caring self is in the middle, and there's, from their perspective, 5 different factors that lead to sort of piercing or hemorrhaging that caring self. And the first that they talk about is ambiguous endings. And we talked a moment ago about sort of the endings when we were looking at the felt separation stage. But right, there can be ambiguous endings in our work. We see them all the time. And when they talk about this, they're pulling from Pauline Boss's work on loss. For those of you who may know her work, she originally used the term ambiguous loss to describe the agony that we feel when there's ambiguity in the loss, when it's not clear, and how much that ambiguity can cause significant stress or distress, in part because it interferes with the natural grieving process. And so this is one of the things that we, of course, experience in our work. And if we're not tending to it enough and managing our own care around it, it can lead to, draining and hemorrhaging the caring self. The second then is professional uncertainty. And this really takes a bunch of different includes a bunch of different things. Certainly the uncertainty from human complexity, competing ways of knowing in our field. We have empirical, quantitative, scientific research and qualitative methods, our own experience, both professionally and personally, information that we get from mentors and supervisors. So there can be a lot of competing information sometimes and multiple areas of professional uncertainty, as well as the things we are most familiar with: burnout, compassion fatigue, and vicarious trauma. All of these can impact significantly the caring self. Now to look at more specifically, what are the hazards of our work? And I am not going to go into these in extreme detail because I think we all know them, but I do want to point them out because it is essential that on the one hand, we don't want to drown in them. And sometimes it is hard to look at these lists of our hazards because there's a lot of them. We're in a challenging field. And yet, we also have to be able to acknowledge them, because failure to acknowledge them will land us in the place where we're not paying enough attention, we're not being self-aware, and then we can end up in some of the difficult spots we'll talk about in a few minutes. But in terms of hazards, and this, by the way, comes from Norcross and Van den Bos, the way that these are broken up. I'm using this because I think they did a really great job of just very succinctly, but also thoroughly listing some of the hazards. And no doubt you'll recognize hazards here, hostile transference, suicidal and or homicidal or aggressive patients who are violent with us, premature termination, those kinds of things. Also in our working conditions, right? Organizational politics, managed care, this is a big one. Also these days, regulatory issues, right? Compliance, it's listed there, compliance with excessive regulations. These days, it's a lot of stress related to interjurisdictional regulation regarding teletherapy and can I work across state lines and those kinds of things. Work constraints, excessive workload, which many of you yourselves mentioned, and so forth. Also, then there's the emotional depletion of our work. And this is, as all of these are, very real hazards. We can get to a place where we feel bored and experience the monotony of our work, extreme exhaustion or fatigue, difficulty leaving work at work, which is especially hard now that many of us are actually working from home, which makes it all the more difficult to really leave work at work and get that space that we need to rejuvenate ourselves. And then there's, of course, others listed. Also key and very important in our field is this psychic isolation. And this comes, in part because of the work we do, right? We have to maintain confidentiality. The consulting room is very private. We can't go home and share with our families the details of our day as if we could if we were, say, a veterinarian or a librarian. We could share, hey, I met so-and-so. And they told me this, that, and the other thing, but we can't do that in our work. So it does lead to a kind of psychic isolation. Also one-way intimacy, and that we have to sort of control our emotions more because we're putting the other first, which is very important. But we can also sometimes get in that habit, which of course we need to for our work, of setting aside our personal concerns while we work. But if we then take that habit into our home life too, which sometimes we do, then we're never actually doing that turning toward ourselves. We're never actually doing that self-awareness and self-reflection piece, which is the very protective thing that we need. Additional hazards include, of course, aspects of the therapeutic relationship that we're all familiar with, and personal disruptions in our lives, which create significant vulnerability for us as clinicians. And, you know, who among us has not experienced personal disruption in this last year, right? There is research and literature out there showing, you know, for clinicians who at some point cross boundaries and or have you know, sexually inappropriate relations with their clients, a lot of times it's in part, or at least in one direction, due to sort of their own vulnerability and their own, maybe they're experiencing a divorce or significant loss, and it leads them to seek nurturance from a client. So these things are really impactful on us, of course, as humans, but also on our work. And then, of course, there's some miscellaneous stressors as well. Okay, so after that long list, I've just included a few funny images here to help lighten us up. Humor and laughter is also a really good self-care technique. Usually doesn't take very long for it to have an effect. So we include that here as a brief respite from some of the heaviness. Okay, so looking specifically then at risks of our work, what are the risks that we encounter? We're going to come back to some of these, so I'm going to list them quickly here. Distress, burnout, STS or VT, you'll see me abbreviate those later in the slide, secondary traumatic stress or vicarious traumatization. Also compassion fatigue, sometimes in the slides abbreviated CF. It can lead to errors in judgment. You know, when we ourselves are, say, maybe we've had a loss and we're experiencing grief, or perhaps we're so overwhelmed that we're experiencing depression or anxiety, it can lead to us making bad decisions with our clients. We can sometimes be snappy. We can react really quickly in a very poor way, and that can have significant impact on our treatment. We can also experience impaired competence, failure to meet legal and ethical obligations, and of course, this can all lead in the extreme tragedy that we actually harm the very people we're attempting to assist. And in some instances, it results in licensing board complaints and lawsuits. So just a quick look at some stats to sort of bring home this, like, is it real, is it not? Because I know sometimes I talk with clinicians at workshops and various other capacities, and they're like, well, why are we focusing on this? And it's because it's a real thing in our field for all of us as clinicians. And Luther et al. In their study in 2017 found that there's really a tendency for clinicians to overextend themselves with their work. And I will tell you, in the work that I do with clinicians right now across many different scenarios, I hear this all the time. I hear people say, well, I just can't say no. I just had to take on this other client. And I say, well, why did you have to? Well, there's no one else that they could see, you know, that they feel this real compulsion to just give and give and give. And the problem with that is that it's actually detrimental, of course, both to the clinician, but it can really be detrimental to the client. 52% of participants in the study reported working overtime hours any given week and having that resulting in symptoms of burnout. So we're not talking here about overworking, you know, once every few months, which, you know, may happen. Life is going to happen, but this is a pretty steady overtime working. Also, 61% in a different study of sample psychotherapists met criteria for clinical depression. That's pretty high. And in another study by Simpson et al. In 2018, 79% of respondents reported experiencing work-related stressors that impeded optimal therapy, and 72% of those reported ruminating about it at times. So we as clinicians, per these research studies, really are experiencing significant levels of stress and, in some cases, depression and other symptoms that are impacting our work. Looking at some of those hazards that we talked about, research suggests that more than 30% of clients that complete suicide at some point in our career, and upwards of 33% of those of us who do experience that will suffer severe mental distress as a result, because it's such a traumatic event for us. Literature also shows that as many as 50% of all psychotherapists will experience harassment, and in some instances, although more rare, physical attack by a client. Also, between 75 and 82% of therapists reported experiencing a distressing event in the past 3 years. And this is older research from Pope et al., but they found in their study that 62% of psychotherapists reported working while being too significantly distressed for it to be effective. That's glaring, I think, right? That's really startling. And to me, it just calls for, we have to really tune into this. We have to tune into ourselves and our own self-care, and we have to tune into each other and help each other. We'll come back to more of that in a moment. How do we do that? But I want to, for a minute, take a look at this stress-distress continuum. And this is the continuum put out by the APA Board of Professional Affairs Advisory Committee on colleague assistance. And as you can see, it is a continuum, starting with stress, right? The place of stress, and then that moves into distress. And we'll talk about how that's defined in a few moments. And then from there, you can move into a place where we are actually impaired. And then if we keep going and we don't address our own self-care or our needs appropriately, we will end up in the place of engaging in some type of improper behavior with our clients. So, and we're going to come back to this continuum in a little bit, but just sort of keep it in mind as we go through some of these next slides. So in terms of distress, what do we mean by that? Well, Barnett and others have defined this as the subjective emotional state or reaction experienced by an individual in response to ongoing stressors, challenges, conflicts, and demands. A key thing to keep in mind is that distress is actually normative in an intermittent way, right? We expect and should expect that there will be times where we experience distress. That doesn't mean that we are impaired. It doesn't mean that something's wrong with us. It means that we are engaging in challenging, care-intensive work, and we too are humans. So it's going to happen. But it is also a beginning warning sign. And this ideally is where, at the very least, we want to be catching ourselves in this place of distress. Now, I'll talk later about ways maybe we can catch ourselves sooner, but if we are experiencing symptoms of distress, and we're going to look in a second at what those are, that is our warning sign. In some ways, we should sort of see those symptoms and welcome them as sort of this red flashing light that says, hey, you need to stop and pause. You know, you need to really tune in and pay attention. And we all experience this, right, at some time or another. But to be clear, there's also no bright lines. You know, so if we go back for a moment to this continuum, the stress-distress continuum, there's not a fine line between stress and distress, between distress and impairment and proper behavior, right? There's some gray areas in there, and it's possible to be distressed but not impaired. But you know, at some point, it is going to lead down that path, and so we want to be aware of that. Also, it's possible, because it's not so clear, that we may only be able to see where we were on that continuum in retrospect. And on the one hand, you know, that's good, better that we see it in retrospect than never at all. But it does, I think, also speak to the fact that we want to really get good at self-reflection and self-awareness and self-monitoring on these issues, which we'll talk about more at the end of today. There is research showing that psychologists report depression as a primary symptom of distress. And, you know, not surprisingly, it's linked with low motivation, poor concentration, fatigue, sadness, and lack of enjoyment. Another study has shown that a large number of psychologists acknowledge experiencing distress in the prior 3 years, and over 1/3 of them said that their distress had adversely impacted the quality of the care they provided, with fully 5% noting that their care was inadequate. So this can have very serious consequences for our work. And additional research showed 60% of practicing psychologists reporting that they had worked when they were too distressed to be effective. So, okay, what is burnout then? So we understand distress a little bit. What is burnout? Well, Ellen Baker talks about it as being the terminal phase of therapist distress. So it's sort of like the end side of distress, if we let distress go for too long without being attended to. Freudenberger first used the term. He was talking about wearing out, and I will say, there are many definitions to burnout. There's also some debate about potentially it's a multidimensional syndrome. I'm not going to go into all of those details, but I do want to point out that what is sort of consistent among the literature and the research with burnout is that it all points to a profound weariness, just a complete exhaustion and depletion. Christina Maslach and Jackson talk about this conceptualization, tripartite contextualization, that has 3 core dimensions. And the first is exhaustion, really just that sense of depletion, both physical and emotional, feeling drained, depleted, worn out. The second then is depersonalization. And this, sometimes we can end up being more irritable or detached. It also, in this sort of context, we can start to have a negative and cynical attitude toward oneself or our work, and sometimes towards life in general. It also can show up sometimes as a callousness toward our responsibilities, or in some instances toward our clients. And the last one then is ineffectiveness, or reduced personal accomplishment. There are, again, different terms for these in the literature. But this is really where we as clinicians can experience a sense of sort of incompetency. And we can have feelings of hopelessness and sometimes helplessness. We might sort of think, well, what's the use? And start to view our work in a real negative dimension. And in many respects, then it loses its value and meaning. What we are doing loses its value and meaning. Now, one thing to keep in mind is that burnout is not specifically linked to treating only traumatized patients. Burnout can occur with any caring relationship. Interestingly, 2 years ago in 2019, the World Health Organization actually officially recognized burnout as an official medical diagnosis. And this was the definition they gave. A syndrome resulting from chronic workplace stress that has not been successfully managed. And again, they outlined the 3 dimensions: feeling depleted or exhausted, increased mental distance from one's job, or that sort of negativism and cynicism. And third is the reduced professional efficacy. Here they did note that it's, again, burnout is very specific to workplace stressors. In terms of sources of burnout, this comes again from Maslach and Leiter's work. There's multiple different sources, but one is workload, right? Many of you mentioned this in your answers, but having too much work, not enough resources. Also, issues of control. Are we being micromanaged? Is there a lack of influence? Do we have a ton of accountability but very little power? Those kinds of things. The reward, is there not enough pay, not enough acknowledgement, not enough satisfaction? Also community, and this is encompassing things like isolation. Is there conflict in the community that we're in? Is it a disrespectful, or in other cases, are there discrimination and favoritism? And then also the issues of values in terms of ethical conflicts or meaningless tasks. These can all be sources of burnout. Burnout can also go in two sort of primary directions. Anxious and irritable, or depressed, more depressed and withdrawn. And here are the common symptoms, right? And so it's important that we know what they are. Hopefully all of us do anyhow, but important to read these because, you know, these are the places we want to catch ourselves. So fatigue and emotional exhaustion, as we've talked about, depression, absenteeism, irritability, disenchantment or hopelessness, that same cynicism, you know, and it goes on. I won't read all of them to you, but certainly increased errors in work, ineffectiveness, and just get a place where we don't care as much, right? Or we don't care about the quality, avoidance sometimes of work, and sometimes even that overconsumption of food. So all of these can be symptoms of burnout. And it's important also to know that symptoms of burnout actually can develop insidiously over time, and they can be hard to see, right? Which is why sometimes we only see them in retrospect. But we need to really, really attune ourselves to this so that we can catch them as early warning signs and hopefully don't end up entirely burned out before we start to respond. McCormick et al. Did a fairly recent systematic review in 2018, and they found that the most commonly cited dimension of burnout was emotional exhaustion. I think that's not surprising, and I'm sure that many of us have experienced that at some point in the last year. It certainly is characterized by a lack of energy, sometimes negative affect, and just that sense that we are depleted, we have no more resources to give. It can lead to seeking an escape or distancing, both emotionally and cognitively from our work. And this is where, when we start to do that in interactions with our clients, right, that's where those errors in judgment can come in. Because we may be doing something either to protect ourselves or to shut down or something, but that may be the exact wrong thing that our client needs. Certainly, as we've mentioned, it can also lead to feelings of cynicism. And not surprisingly, workload and work setting are the most common job demands that were found to contribute to burnout. Okay, they also found strong and consistent relationship, as we mentioned, between high workload and burnout. So again, pay attention to that, because many of you and us wrote in saying, I'm having an extremely high workload. So this is where those radars should be going off. Also, not only the amount of work, but this idea of the perceived accessory work. And here, I think, especially in the last year, we see this sometimes with the managed care stuff, but also in particular with telehealth, a lot of the technology aspects of telehealth, the additional things that we have to do in record keeping for telehealth, the necessity for us to research and understand different regulatory rules in different states, all of that accessory work also can contribute to burnout. And they found too that the tendency to put others' needs before their own can predispose psychologists to burnout. And we, in many respects, as mental health practitioners, have a very strong tendency to do that. And so whenever we find ourselves doing that, or certainly find ourselves in the place where we're like, I just can't say no, I need to do this, that's a time to really question that and question ourselves, and maybe reach out for consultation, because that is a prescription for burnout. Now, we know that there's widespread, and they of course found in this review too, there's widespread evidence that social support is actually a very strong protective factor for burnout. And we're going to talk more about that in part 2 in a couple weeks. But what's interesting here is that this research showed that psychologists are hesitant to seek help. And that in one study, 60% reported not seeking help, even though they needed it and could have benefited from it. So that again is very striking. You know, even in our own field, whether it's because of stigma or whatever it is, there's a significant hesitancy to reach out for help, even though we know how much help, legal support or therapy, whatever it is, that help is available. And that too is really concerning. And I hope not only can we start to change that individually for ourselves, but over time, I think as a field, we need to start to change that in our profession, and really, really turn that on its head. As we've talked, there's growing evidence linking burnout and practice errors with ethical violations. We know that burnout refers to the draining effects of the work environment, which is important, right? It's the environment that we're in many situations. That's the way that burnout is viewed. And therefore, right, the idea that, again, it isn't our fault. We're not doing something wrong. We are not wrong. It's the environment that we're in. But we don't then want to assume that that means that just because it's our work environment, there's nothing we can do. That's actually very risky. And Scoville and Trotter Matheson talk about this idea of a professional greenhouse, which is just one way to sort of combat that. And they talk there about creating this greenhouse at work, right? Which is really an environment where clinician growth is encouraged, where leadership actually promotes that balance between caring for others and caring for self. Where there's strong professional social support, and we receive care and support from our mentors and supervisors. And also we receive sort of the nourishment that comes from being a mentor and a supervisor. In addition to sort of just learning how to be playful, right? Play and humor go a long way. And so this idea of a professional greenhouse is something we can start to attempt to institute. And for those of you that, run organizations or practices as the leader of groups, you can start to change the culture in a way that can help set up an entire workplace that helps to prevent burnout. Relatedly then, Aubrey and Gentry talk about, they talk about burnout sort of similarly as most of the literature does, but in particular, they say that it's these three components related to perceived demands that outweigh perceived resources and, perceived resources to accomplish those demands. So what they're trying to do is make a switch the focus from external circumstances that are out of our control to our internal responses, which of course we can control. So they advocate very strongly for a focus on self-regulation, building and strengthening, our nervous systems, our physical regulation, strengthening vagal tone. There's a lot of research out there on how important these are and how much impact they can have on our physiology to help calm us down and reduce stress, but also then other resilient skills. So this self-regulation, and if you remember Ellen Baker earlier in the beginning, we talked about that as well. Self-regulation and resilient skills, and that if the more we build these, we can in essence inoculate ourselves against burnout and the other stress-related conditions. So we're already starting to see hints of what's the pathway out of this, if in fact we're already in some of these states, and also what is the pathway for prevention in the future. So let's look a little more detail about burnout creation versus prevention. Of course, to create burnout, we have work overload versus a sustainable workload. And, now I think all of us need to give some pretty careful consideration to what is sustainable, and what is sustainable for us, for me, because what's sustainable for me may not be sustainable for someone else, and vice versa. I have some colleagues who I'm like, wow, I could not do what you do in the way that you do that. I wouldn't last for that number of hours or that, whatever it is. So it's also individualized. Also, of course, lack of control versus having a sense of choice and control over things. Insufficient reward versus good recognition and reward. Breakdowns in communities versus having a sense of community. And we're going to talk again about more of that in part 2. Unfairness versus fairness, respect, and justice. and the values conflict that we mentioned before versus having meaningful valued work, and the lack of fit versus high job person fit. So that's sort of burnout. I want to turn for a minute, and I'm gonna, I might speed up a little bit here just to make sure we get through everything, but I want to turn for a minute and look at some of these other syndromes. I don't really like that word much, but conditions that we experience in our work. And so this is compassion fatigue, secondary traumatic stress, and vicarious traumatization. These terms are often used interchangeably. There's in some ways sort of overlapping concepts of direct or indirect exposure to challenging or traumatic events and material. I do want to say, as I said, there is overlap here in the concepts. The terms are used differently in different research. We're going to make some distinctions as we go through. I'm not going to make all of the distinctions because that is not my focus here. What I'm trying to do today is to give you enough information to help you understand the basics, and importantly, to help you recognize if and when you are experiencing these kinds of experiences, so that you know what it is when you're there and how to get out of it. Very important to keep in mind here the role of empathy. And I'm going to talk just more about that in one moment on a different slide, but important for us to realize that caring, the very caring that we do and the compassion allows us to excel. That is one of the strong things in our field that allows us to be successful, right? But it is also the very thing that can put us at risk. And as Larson refers to it, empathy is both simultaneously our greatest asset and a point of real vulnerability. And so being vulnerable, though, yes, we can do that, but we need to acknowledge it and pay attention. Compassion fatigue, originally coined by Carla Johns in 1992, related to work in the emergency room where she observed nurses who seemed to lose their compassion when providing care to patients. Then in 1995, Charles Figley went on to actually define the term, and he really saw it as being the worst consequence of secondary traumatic stress. And he viewed these sort of conditions as being the cost of caring. I will say there's a bit of a sort of debate or differing opinions on whether we should call it actually compassion fatigue or empathy burnout or empathy fatigue. And sometimes there's just this distinction made between compassion being the ability to feel for the other person, and empathy being the ability both to understand another's feelings and, in a sense, to become one with that individual's distress. And that is where, we really can step into the other's experience in a way so much such that sometimes we are beginning to experience it ourselves. Many of us that are familiar with this idea of mirror neurons and some of the research that has been done, although there's still no doubt more research to be done on empathy, the research on mirror neurons comes from began in the mid-1900s when researchers were studying the firing activity of neurons in monkeys. And they were looking at what was firing in the brain when the monkeys reached out to grab raisins. And they noticed that the firing of the neurons in the motor cortex would fire not only when the monkey themselves would perform the task, but actually when the monkey was observing the researcher reach out and grasp the raisin. So the idea here is that the same neurons activate when we perform an action as activate when we observe that action, and that our empathic response then is understood as these mirror neurons actually connecting us with one another. So the reason this is important, or one of the reasons this is important, is because empathy then is not just a psychological phenomenon. It also involves somatic elements. And to quote Adrienne Gentry, it entails mirroring the physical reactions of those whom we are helping. So it's almost like we can literally have similar physical reactions. And Daniel Stern talked about this in a very different context. He was talking about this in the context of development, child development, and he referred to us as being prisoners of someone else's nervous system. And the reason this matters is because, again, we can experience those things that our clients are experiencing. So it really can become a felt, lived, physical experience for us. Compassion fatigue, like burnout, occurs cumulatively over time. The expression of compassion fatigue is highly individualized. These are just some examples, symptoms. You may have some, you may have others, it's very individualized. Importantly, it can be accelerated by our own prior wounds and experiences. Things that we might have experienced in our life prior to the work we're doing can actually make it worse or accelerate that and really work to drain us emotionally. And compassion fatigue is a natural and inevitable consequence of caring for others. And we've talked about this, that it's not a sign of weakness or character flaw. This is natural, and it is just simply the byproduct of caring, or caring without tending to our own needs as well. It can result in higher levels of helplessness and a feeling of being isolated. We've talked some about that. It can also create a significant difficulty for us in doing that regenerative and renewing work. It can occur without exposure to traumatic events. So we don't necessarily have to be working with clients who've experienced trauma in order for ourselves to experience compassion fatigue. It's really just from the chronic exposure to someone else's suffering. There can be a predisposing factor for us when we're working with someone where there's a parallel between what's happening there and our own history. And more recently, it's been defined as the overall experience of emotional and physical fatigue from this chronic use of empathy with individuals who are in distress or suffering in some way. So looking then at secondary traumatic stress, or STS, this is really sort of that experience, a painful learning of experiencing or being exposed to another person's traumatic experience. In contrast to burnout and CF that we just talked about, this is an acute reaction. It typically develops very suddenly, and it's pretty close to actually those who suffer from PTSD, post-traumatic stress disorder. Comes out of the work of Perlman and McCann, who demonstrated that there can even an indirect exposure to trauma can lead to the development of traumatic stress symptoms. So we don't have to experience the trauma ourselves directly if and when we are working with other people who have experienced that, and we're doing that repeatedly, we then can experience our own traumatic symptoms, also sometimes called vicarious traumatization, or VT. Again, these are some of the big names in this area. It comes from vicarious traumatization, really is the cumulative effect of working with traumatized clients. This will happen over time if we are doing a lot of this work and not sort of really tending to ways to protect ourselves from this. It is, and this is one of the key things that sets vicarious traumatization apart from the other conditions we've talked about, is that it is associated with cognitive changes and beliefs about the world. It's really, it has a tremendous impact on the clinician, vicarious traumatization. It can really change how we think and feel. It can interfere with therapist feelings, our own sort of cognitive schema, our memories, sometimes our self-esteem, and certainly also our sense of safety. And it can change how we think about the world. So it can have quite a dramatic impact on us. It typically comes on quickly and can be very overwhelming for the clinician. As I said, there are profound psychological effects that can be very disruptive. And importantly, these symptoms can actually persist for quite a time, even after we stop the work with traumatized people. So this sort of is a more extreme condition that we can experience, because it can continue even if we stop our work. And as we've talked about, right, we as the clinician are really experiencing that trauma secondhand from listening to the stories. It can lead, some of the cognitive changes that we can experience relate to sort of pessimistic and inflexible thinking. So things that many of us, of course, are aware of from our own work: all or nothing thinking, the shoulds, oughts, have tos, and must, catastrophizing, jumping to conclusions, things like that. And so looking at some of the differentiations, right? How do we start to distinguish some of these to some extent? Both burnout and compassion fatigue happen over time. Burnout is specific to work or work culture or practices at work, whereas compassion fatigue is specific to caring for others, either who've experienced trauma or who are just experiencing, emotional suffering. It doesn't have to be trauma. And burnout does also carry with it an increased risk for chronic fatigue, for compassion fatigue. And compassion fatigue may include symptoms of burnout and sometimes even of secondary traumatic stress. So if we're looking then at STS versus PTSD, both of them are triggered by a direct or indirect exposure to trauma of some kind. Of course, secondary traumatic stress does not meet full criteria, but in PTSD, you must meet the full DSM-5 criteria. STS and PTSD may or may not coexist with compassion fatigue. And both of them have the sudden onset or cumulative exposure. So we just were looking at, right, all of the conditions that we were talking about: burnout, vicarious traumatization, et cetera. And I want to now start to shift a little bit. Again, we're not going to go into great detail about what we can do, but I think there are some points that we really want to sort of take home points we want to have with us now. And then, of course, we'll get to more details in part 2. But one is that it's not inevitable that we're going to have to experience these kinds of conditions. There will be stress, there will be periods of distress. We may end up in burnout or compassion fatigue, but we don't have to. There are ways that we can build up our own resiliency. There are skills we can teach and train ourselves to do to develop, greater resiliency, greater self-care, and this concept, as I know many of us are familiar with, of post-traumatic growth, which generally is considered to be a positive condition. Yes, it comes with some difficulty, but it's really about finding that new meaning after hardship, viewing and sort of living the self as being resilient and capable. Having a fundamental and creating this sense of hope for the future, and sort of valuing relationships differently. And this is possible, of course, as we know, for our clients and for us as practitioners. So I want to return for a moment to this stress-distress continuum that we talked about earlier. And in particular, I want to talk about the need really expand this continuum, because if you notice, that continuum in many respects is really only one half of the continuum. What if we start in a place of stress, which that continuum does, we're not leaving room really for other alternatives, right? We have all the negative alternatives: stress, distress, impairment, so forth, but we're not leaving room for what we hope is the other end of that continuum, for the things that make prevention, protection a possibility, right? And so Weiss, Hirsch, and Gibson wrote a great article on this, where they really envision this idea of a positive continuum, where there's another half to the continuum that allows for a spiraling up, that allows us to focus on well-being, and to enhance our functioning in that space of well-being, which hopefully then also has the advantage of greatly reducing the likelihood of us progressing through the more negative stages. If we think too about the stress-distress continuum, we don't want to only do self-care once we're stressed, right? We don't want to start in that place. Ideally, we want to be living self-care all the time so that we don't get to the place of distress or burnout. And this sort of model, stress, distress, impairment, improper behavior, also, I think feeds into some of those underlying assumptions that it's sort of that stress or distress should be tolerated, should be accepted. And now let me be clear here. When I say stress, of course, stress is going to occur, right? And as I said earlier, there are some forms of stress that are good stress, right? As I said, some good aspects of stress can actually energize us and can lead us to make greater improvements and greater strides and challenge ourselves and actually end up with greater rewards. So I'm not saying here that all stress is bad by any means, but the stress that sort of continually builds and builds and builds and builds does eventually, or can eventually, if not tended to, can turn into that really negative stress, which is going to start to have all the physiological effects that we know stress can have on the body, and the body and the psyche. And so I do want to, like this, expanding the continuum, right? We don't want to just buy into the assumption that starting in a place of stress is what should happen, or that we should tolerate that. If we broaden the perspective, we open the possibility that there are other places that we can live from as well. It also allows then for this idea of the awareness of the reciprocity between care of ourselves and care of others, which harkens back to that quote by Hadler, right? Where he says, if I really take care of myself and do the things that feed me, then I'm better in the room with my clients. And we know this to be true. We also often tell this very thing to our clients, but sometimes we neglect to do it for ourselves. There's this really incredible reciprocity. And when we're in these states of good self-care, where we're really tending to and nourishing and nurturing ourselves, when you've had that experience, then I think you also know that you enter into that consulting room in a very different place. And not only do we know it, but importantly, our clients can sense that, right? They know it too. We know how attuned some of our clients can be to us, and they know it. And it does allow us in many instances to be more effective, both more effective when things are going well in treatment or evaluation or whatever we're doing, and also more effective and importantly so when things are going poorly. If we have a client who is angry with us, or someone who's screaming at us, if we are in a good, solid, nurtured, rested, rejuvenated place, we're going to be able to respond to that angry client in a manner that is much different than if we are depleted and behaving sort of irritably ourselves or impulsively ourselves. And lest you have the sense of like, oh, I would never do that. Because I do think we block ourselves from seeing stuff. We think, well, I wouldn't do that. I know I wouldn't, I would never do that. I will tell you that I talk with a lot of clinicians who say, I can't believe I did this. I never thought I would do something like this. And yet we can do it, not because we're bad people or bad clinicians, but because we fall victim to these conditions, right? Burnout, distress, etc. And it really does lead to problematic behavior, errors in judgment that then create significant problems with our clients at times, and again, do real harm. So just getting back to this need to expand the continuum then, this is sort of my own take on this broader continuum. If we add, and I think this is not even sufficient really, but if we add the part on the other side, right? Here, I needed to fit it all into one screen, but ideally, I think there might be even more steps than this. But, if we have the stress, distress, impairment, improper behavior on one end, but then, surviving is another step, and then flourishing. And maybe there's even a step in between those, like thriving or something, but where ideally we would want this left part of the continuum to be as balanced and lengthy as the right side, right? Because that then can encompass sort of more of human behavior and human possibility, right? We don't have to live in a place of stress, fearing sliding down to improper behavior. Ideally, we can live in a place of flourishing and thriving, of where our well-being is fundamentally sustained, and we are regularly nourishing and feeding that in ourselves. And then, right, that, as I said in the slide before, that allows us, hopefully, to see more quickly when we're heading down these places. Because if we are living in a place of flourishing, by the time we get to stress, we're hopefully going to know, like, wait a minute, I'm really in a very different space than I normally am. What's going on? And so we can address it much sooner rather than waiting until we get to some of these more intense places of impairment that, of course, really negatively impact our work. So what are some of the essentials then of self-care? We know, of course, as I've mentioned multiple times, this idea of self-awareness. And self-awareness includes both that capacity to notice, but also the capacity then to address our own needs, and to do this in a way that we do as generously with ourselves as we do with others. And it really is sort of one of the most, not the most, but the first and sort of foundational requirements, because again, we can't address a need if we're not aware of it. And so we're going to talk, I'm not going into great detail today about how we're going to do self-awareness, but we can talk a little more about that in the part 2 webinar. Also then is self-assessment, right? So we need to be able first to be aware of things going on in ourselves. And we also need to be able to assess where we are on some of these continuums. And there are different ways that we can do this. We're going to get into more detail of this also in part 2. But for instance, there are some sort of checklist and qualitative questionnaires we can fill out and sort of do a self-assessment. But as I mentioned earlier, there is some research to show that we're not always that good at self-assessment, and that sometimes we tend to be overly positive about ourselves and assess ourselves as doing better than we really are. And so it's important that we also have others in our lives who can help with the self-assessment, right? So we have colleagues, hopefully, who can give us feedback. I know many of us attend peer consultation groups, and those groups are really a very good place where we can sometimes get feedback on this. But it's also important that we're getting feedback and attending groups where people will give us honest feedback, right? We don't want to just attend a group where everyone's going to tell us we're doing fine or not be forthright and honest with us. So who we are in groups with, who we are seeking that kind of support from, matters a great deal. And then, of course, the third component is self-monitoring, that we have to really continually be monitoring this. This is not just a one-time assessment, right? As I mentioned earlier, our self-care needs will change throughout our career and will change on a day-to-day basis. There may be, weeks where we are having just incredible intensity in our lives for one reason or another. And we, in those instances, may need to really increase our self-care. And then there may be weeks where it's a little less intense. And so we might be able to step back some, but it's a constant monitoring of this. And then a constant sort of flowing with that. What do I need now, right? Getting back to that question we asked at the beginning, and then being sure that we address that. Because that latter piece is the other part that sometimes is missing. Sometimes we know what we need, and yet we either choose not to do it for whatever reason, or we feel like we can't do it. And sometimes maybe that's true, but oftentimes it isn't. And so it's important that once we know what our needs are, that we actually address them and allow ourselves some space to receive whatever it is that is needed at that time. And sometimes we, as psychologists and mental health professionals, are not so good at the receiving end. And yet, I think I would argue that it's really essential to the work we do. Okay, so what are some pathways then to flourishing? How do we get to that left end of the continuum that hopefully we want to get at and live there for the most part? Well, there's different ways, but certainly developing neuro-based, trauma-sensitive, resilience-focused, and consistent self-care practices. Again, keyword there on the practice, that minimize the impact of the unavoidable stressors in our work. Okay, we're never going to get rid of the stressors in our work because they are part of the work. And again, some level of stress can be helpful to us. So that's okay. It's just that when it's overwhelming and becomes, where it's really bogging us down and getting us stuck in these sort of darker places like burnout, compassion fatigue, that it becomes a real problem. And I do want to just go back to that, the phrase there of self-care practices, because a lot of times, again, in today's society, there's this idea of self-care is something that we do, like we have to put it on our to-do list, and then it becomes this just extra burden, right? Now it's on my to-do list, like, oh my gosh, I can't get to exercising today, or I can't get to go into the gym today, or those kinds of things. And then we can start to feel that guilt almost that comes along and feel like we're starting to fail because we're not able to get to that self-care to-do list on top of everything else. And we're going to talk much more about this in part 2 as well, but that's where some of these really small practices can come in handy. And, like that we did at the beginning, just that very short couple of minute self-check-in where you just pause to breathe. Humor, various things can work on very quick timelines, very short, not taking a lot of time. But it's also true that once you start to really, and we're going to talk more about how to do this in part 2, once you really start to make a transition from self-care as like something else on your to-do list that you check off, and you turn and transition that more into, this is how I live my life. This is how I live. And it's a daily lived practice in the same way that we do other self-care stuff, right? All of us sleep at some point, I hope. We brush our teeth. There's things that we do on a day-to-day basis. Now, we might want to increase some of those. We might want to eat more, or eat less, or whatever. But when we transition to the idea of self-care not as a to-do list, but as an actual integrated, this is how we function, then it really takes hold, and we start to notice these things sooner. That self-awareness and self-assessment and self-monitoring are integrated into our daily lives on an ongoing basis, and it just becomes part of what we do. It's not something we have to put on our to-do list, right? We don't have to put breathing on our to-do list. So we want to eventually get to that kind of place, but that will take some time and some sort of self-training in a way, right? But other pathways, that I want to sort of mention here include, building resiliency skills. And Aubrey and Gentry talk about several different kinds of sort of categories of these resiliency skills. Certainly self-regulation is one of those categories. And we've seen that in others' work as well, Baker in the beginning and some other places. But this idea of self-regulation, we also are familiar with this in the trauma work, right? In trauma literature and trauma treatment, that self-regulation is actually one of the first places we start because of the very powerful impact that these kinds of stressful or traumatic experiences can have on our nervous system and on our physiology. We need to start in that place and start with that kind of regulation first and foremost. So it gives us a firm foundation. Also then intentionality. Self-care, we have to be, it's very intentional. It's very focused. Again, the awareness. And so I'm not going to go into great detail on that. We'll talk some more in the future. Also then this idea of cognitive and perceptual restructuring. And, we talked some about this along the way already, where we were, seeing how some of these conditions can really impact the way we view the world, the kinds of thoughts we have. Also, if we fall into the trap of, with burnout, for instance, thinking that, well, this is just the environment I'm in and there's nothing I can do about it. That actually isn't true. We may not be able to have complete control over the environment, but we do have control over how we are seeing things. And our own sort of perceptions of it and how we take that on. Also then the skill of connection and support. And definitely we're going to get into more of this in part 2, but, and they really talk about this as a skill, but it's also, I know Norcross and Vandenberg, for instance, talk about it in multiple ways too, that it's not just, building in sort of multiple layers of connection and support and having these in multiple places, which can be really supportive. And again, that idea of inoculating us against some of the more harmful impacts of our work. And then, as they call it, the skill of self-care and revitalization. And I really see all of these as a part of self-care. But these are, I think, one of the main take-homes here is that there are skills we can use. There are skills we can develop. Not all of us came into the world knowing how to care for ourselves. And sometimes knowing how to care for ourselves, some of us may not have gotten really good caring or had good models of that growing up, or in some other areas of our life. And so we may have to learn how to do that. And that is part of it. It's part of course, growing as humans, but also growing professionally, right? These sort of development of self-care, of course, will change across career, but hopefully we're getting better at it, ideally, as we move along our career path. So what does it mean to have effective self-care? What does effective self-care look like? Because again, and before I go into define that, I want to just say, we can have a lot of things that are supposedly quote unquote self-care, but if it isn't really effective or nourishing for us, then it's not going to be self-care. And again, I want to make this distinction between self-care and kind of self-indulgence, although that carries a very negative connotation, and that is not what I'm referring to. But that's what I was referencing earlier with sort of that numbing out or escapism, because that is not necessarily the same thing as self-care, right? Numbing and escaping may serve the purpose of getting us some distance from some of these distressing emotions or experiences, but it isn't actually rejuvenating us. Most of the things we do to numb out, drink alcohol, eat food, whatever it is, watch TV, binge Netflix for 3 days in a row, whatever it happens to be, those kinds of things, they may allow us to escape for a bit, but it's not actually revitalizing our body. It doesn't give us energy. For those of us who binged Netflix, if you think back, you didn't end that binge session feeling energized. Typically, it's also kind of exhausting in a way. So it really is key when we're thinking about what do I do for self-care, is this concept of how am I feeling? Am I coming out of this quote unquote self-care activity feeling more energized, nourished, rejuvenated in some way? Okay, so what does effective self-care look like? First of all, it's personalized and individualized, right? What works for me may not work for you. And again, it will change. I know personally, some of the things I did for self-care 2 years ago are now different. My self-care strategies in the pandemic have had to change, right? So, and I'm guessing that's true for many, many of us because our lives have changed. Many of us have children at home and family at home, and don't have the space to do things that we did before. So we have to both do what works for us and do what works for us in different settings and in different places and different times, right? As I said, effective self-care is at its core replenishing and nourishing. If you do whatever the activity is and leave feeling more drained, then that's not really self-care. That is something else. Self-care is deliberative and self-directed. It really is something done on purpose and with intention. And again, this idea of being self-directed. And sometimes the fact that it's self-directed is a problem because if we're not tuned in to ourselves, we may not take the bull by the horns and actually do something. Or as we know, sometimes if we're experiencing depression or really severe burnout, we may get in a place where we don't have the energy to do some of these things. But ultimately, there is going to be this self-directed quality to effective self-care. Oops, sorry about that. Also, then it's sustainable and holistic. So sustainable gets back to that point I was making earlier that, if you sort of have this idea, which some people do, and in all honesty, I think culture today sort of tells us this is what self-care is, but that you've got to exercise for an hour every day, you've got to eat the perfect diet, you've got to meditate and do yoga for an hour, you have, all of these things. And by the end of the day, that's really all you would do. You'd never be able to fit in your work. That obviously isn't going to work because it's not sustainable. None of us have the time to do an hour of yoga, an hour of meditation, an hour of exercise, and so forth and so on. That's not possible. But we can create ways and practices that are sustainable on a daily, weekly, monthly basis that do, get at these other things, nourish us and allow us to continue functioning, ideally in that flourishing state. And again, it's holistic. So self-care, as I mentioned earlier, is really going to look at all of those different dimensions, right? Mental, emotional, spiritual, all of those places, physical. So we're really looking at self-care. How do we tend to ourselves, getting back to that inquiry we started with, in all of these different ways? And maybe we're really, really good at physical healthcare. Maybe we do exercise every day and we move our bodies and we're moving that energy and training our bodies and keeping them strong. But maybe we're really poor at emotional self-care, or maybe we're really poor at spiritual self-care. And so as you're thinking about your own experiences and your own self-care, you can start to think about those places of, again, what am I doing well? What needs strengthening, and where should I create some new self-care practices? As I've already mentioned, it should be integrated into daily life. And we are going to talk much more about this in the second webinar as well about how do we do that? How would we, for instance, start to integrate it into daily life? And effective self-care is comprehensive and flexible, right? And this gets back to a little bit like what I said, comprehensive in all areas and really flexible. There are going to be days that you may not be able to do what you want, right? If exercise is a really significant form of healthcare, self-care for you, you may not be able to exercise every single day. And that's okay. That doesn't mean that you failed. It doesn't mean that you're not doing good self-care. It just means that it didn't happen on that day. And so we have to be really flexible rather than sort of perfectionistic about this. And lastly, self-care is characterized by really a whole set of complex pattern of strategies. And Norcross and Vandenbos talk about this in their book, Leaving It at the Office, which is a great book and will be in the reference list that you guys will get. But it's a really good book. And they talk about how it's really helpful to have multiple different strategies, right? So you're not leaning only on one, but you build these into lots of different places in your life, you know. And we're going to talk, we'll go into more detail about that in part 2. But I did want to at least mention that there so that you guys are starting to think about that as we go. Okay. Multiple pathways to flourishing. Then I also wanted to include this because this comes from the work of Lisa Hines. She has a book called Beyond Self-Care, and she talks about 3 essential components. And I think they're really helpful in terms of also sort of broadening some of our perspective on this that we were talking about with expanding that continuum. So her first concept is this idea of a deep well. And here she's talking about, you know, there's psychological resources within ourselves, physical energy and spiritual inspiration, and really developing these and nourishing these so that they sustain us. You know, because if we have this idea of the deep well, you know, if we can go deep down and deep down we are restored and have extra resources and places, you know, that energy, then when there are tough times, we'll be able to pull from that. And so building in practices that allow us to keep replenishing that well are really important. Also then her second component is this idea of wide margins. And I think this is really beautiful. What she's talking about here, and many of us hopefully do this, but having wide margins sort of around us that protect us, right? So there's these wide margins that we can sometimes eat into if we have to, but building in time during the day for pausing, you know, in the way that we paused, for instance, in the beginning, for rest, rejuvenative rest, relaxation, reflection. You know, how many of us take the time to reflect on the day, to maybe journal, or what kind of reflection do we do? Or are we reflecting for, you know, 5 minutes while we scramble together a lunch and then we just keep go, 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 go? If we don't have these moments of pausing in whatever way that looks like for you, there's no one right way to pause or to reflect. There can be many ways to do that. But if we don't have those moments, then we won't have these wide margins. We're going to be much more scrunched in, so to speak. And when things happen, we're going to have less to come from, less resilience inside. So she talks a lot here in this concept about building in time to live mindfully, and building in time for breaks, which is something I know a lot of clinicians quickly will let go. You know, if for instance, they're seeing clients back to back and usually they have a 10-minute break in between, but oftentimes that 10-minute break becomes 8 minutes, and sometimes it's 5 minutes, and sometimes it's 2 minutes, and sometimes there's no break. They just say goodbye to one and move into another. If we do that a lot, now if we do it once or twice, not a big deal, but if we're doing that consistently, that can become problematic, and it eats away at ourselves ultimately, which of course is going to be harder. for us to do our work. And the final component then is firm boundaries. Now, of course, we know generally what boundaries mean. We know how protective and productive and effective they can be for one's well-being. No doubt many of us sit with clients and urge them to institute boundaries and firm boundaries, and we support them in doing that. And yet sometimes we neglect that in ourselves. And I do hear this a lot from clinicians, and they'll say in retrospect, wow, I should have held more strong boundaries there. I wish I had thought about that. And I will say too, what I often see is that in an effort to do good, in an effort to help their client, sometimes we as clinicians will loosen the boundaries, thinking that it is helpful, thinking that this is the best thing to do. And sometimes it may be, but if we're doing that a lot, oftentimes that can lead down a path where we're going to get to the end of it and there's going to be a significant issue and we're going to look back and say, wow, I wish I hadn't done that. So boundaries are important, of course, as we know in therapy, but boundaries are really important for our own self-care. And one thing that included in this from her perspective is the idea here too that it requires us to really get rid of that cognitive belief that it's selfish to focus on our own needs or our own life or our own health. And I know sometimes when I either talk with clinicians on self-care or I do workshops like this, sometimes clinicians will say, this idea that it's selfish, and even that, well, we shouldn't really be talking about self-care because that's all about the therapist, and really we need to be focused on the client and only the client. And if we say we need good self-care to help the well-being of the therapist, well, that's just selfish. And I think that's a really dangerous perspective to have, and one that I hope someday we can sort of eradicate from our field, because it sets us up for the very problems we've been talking about today. And it's just grossly inaccurate. So as I think hopefully by now we're seeing the truth that self-care is really necessary, not only for self-sustainability, but for the very work we want and need to do for the folks we're providing care for. Okay, so some conclusory thoughts. First of all, self-care is the sine qua non of competent ethical practice of our profession. We cannot do without it. If we don't tend to self-care at some point or another, it will impact our competence, and we can not meet our ethical responsibilities and mandates. Really important that we remember, even if we think this isn't true, that we are all vulnerable, right? All of us are vulnerable. It's not weakness, it's not pathology, it's that we are human beings. And in particular, we are human beings in a care-intensive field. I hope that this past year has sort of reminded all of us of how vulnerable we all are. And when we start to deny that very vulnerability, that in and of itself, I think, is a warning sign. If we can't see our vulnerability, if we're not willing to open our eyes to it, then it becomes a blind spot, and that's very dangerous. We do, as we've seen, we have a responsibility to be aware of and tend to our own needs. That's that ethical responsibility. And I will add, in many states around the country, that actually also becomes a legal responsibility, because there are multiple states in the United States that have actually adopted the APA ethics code into their law. And therefore, it's actually a legal responsibility that we have as well as ethical. Self-care, of course, is the means by which we nourish and sustain ourselves so that we can do it for our clients and so we can do it for ourselves, right? It's both and, not either or. And as Baker says, defining and implementing self-care is fundamental to professional identity. Okay. A couple of last things. Self-care is all the more essential in times of crisis. Sometimes in crisis, what we tend to do is we tend to keep the focus outward, right? We are in crisis mode, we're in emergencies mode. So what does that mean? We're taking care of all of the external details that have to be taken care of, right? Our kids, our pets, our work, our whatever it is. For some people in Texas right now, it's electricity and food and water, so there can be, when we are in a crisis, there's a very outward focus necessarily. But as practitioners, it is very important that we very mindfully and very deliberately also turn that focus back on ourselves, so that we also turn inward and pay attention to what's happening on the inside. Because if we only do the outside, again, we're going to end up in these places. So we can't neglect this. And we ideally want to help each other too. So there are ways that we can sort of monitor and support each other. I don't mean monitor in an egregious way, or oh, you're not doing good and I'm going to report to you to the board. Nothing like that. I mean monitor in, hey, you seem a little off today. Is there anything I can do? Are you doing okay? How can I support you? That kind of connecting in with each other, all the more important. And as I've already said, self-care will look different at different times in our careers and in our lives. And then before we jump into questions, I want to just sort of end on this note from Carl Rogers. I think it's a great quote from him. He says, "I've always been better at caring for and looking after others than I have been at caring for myself," which is of course so true for many of us, I think. But he says, "In these later years, I have made progress." And hopefully this webinar hopes all of us make progress, but hopefully, I think that is our goal, right? If so long as we are making progress, that in and of itself is pretty powerful and profound. So, okay, at this point, we are going to take questions, and Jana did come back on. She's actually, I think, gonna read us some questions, and I'm gonna try to turn my video back on as well and hope that it doesn't lead to connection issues, but
Right.
yeah, probably better if you guys see me, so.
Yes. So we have several questions. We'll get to as many of them as we can. Are there instruments that can identify and measure burnout, compassion fatigue, and vicarious trauma?
Yes, the short answer is yes. And I don't want to just keep saying this, but we are actually going to talk about those instruments in part 2. So stay tuned, because we're going to, we'll talk about those, and I'll give you some resources on that as well. But there definitely are, there's a whole range to look at different aspects.
Mm-hmm. Good. Another question. I have heard burnout described clinically as job depression. Do you believe burnout is a separate construct from job depression?
Yeah, great question. And this gets back to, there's some debate in the field, honestly, and we still don't, a lot of different people sort of view burnout slightly differently. There are folks who say, that it's a multidimensional phenomenon. There are folks who say that it is job depression, that it kind of just is synonymous with depression. So certainly burnout can have features of depression. I'm not going to say yes, it is or isn't. I think what's important from this perspective is, what are the symptoms, right, that might be under either depression or burnout, however we look at it, and how might those symptoms be impacting the work that we're doing with our clients? So yes, it's important, I think, to do more research and to fine tune our terms. But on a really practical level, it's important that we really just look at what are we experiencing and how is that impacting us and the work that we're doing.
Right. Great. Thank you.
Mm-hmm.
What do you mean by neuro-based pathways to self-care?
Great question. And again, that was a bit of a tease, because we're going to talk more about that next week. But I'll quickly say some of it is just, there's a lot of sort of developing science on, resiliency and neuroplasticity and things like that. And so there are things we can do from that perspective that can help us. So that was a quick sort of reference to that. And again, we'll look at more of that in detail, the sort of how to, or what are the actual strategies that we can use for improvement. We're going to focus a lot on that in the second part of this webinar.
Right. Are there gender and personality trait factors that predispose one towards compassion fatigue or burnout?
Excellent, excellent question. There is some research out there on this. In terms of the gender differences, yes, there are gender differences, but some of the research, there's some conflicting information and it isn't fully clear. Certainly in some ways, there's some research showing that women can tend more towards burnout. But certainly also men can experience it themselves as too. So there's not sort of fine distinctions that we can point to. In terms of personality characteristics, there has been research done on that as well. And there are some personality traits, take for example, perfectionism, that will predispose one to burnout. You know, if we're very focused on, I've got to do it right, I've got to do it to the 2000% right, then yeah, we're sort of driving our own level of burnout internally. And so there are some things that are our own, and this is where it gets important that we understand ourselves and our own predispositions, our own ways of sort of operating in the world. And so we know what we need to target within ourselves then in order to address that. But that's a great question.
Well, and separate from the personality traits and other variables, we know too that people who have experienced trauma themselves certainly are at a higher rate, perhaps, of experiencing compassion fatigue or empathy fatigue. So,
yeah, and certainly also I'll add to that, Jana. Thank you for that. I'll add to that, you know, with vicarious traumatization, for instance, if we ourselves have a history of significant trauma, it can reactivate our own trauma as well, and so
absolutely.
we be predisposed to that, and then it can also have a sort of longer lasting impact on us, right? Mm-hmm. We obviously in that instance hopefully we'll get some therapy and work of our own.
Right. Here's another one. What are your thoughts regarding self-care for BIPOC clinicians, particularly as we work with persons of color impacted by acute and cumulative trauma, while at the same time managing our own acute trauma due to current events?
Yes, very intense. I mean, I sort of think of this in the two directions. One, of course, is all of our personal self-care. So what works for you sort of personally to take care of yourself. But one of the really, really important factors I think that's very important in considering this is the community. And so finding support, finding groups that are, you know, other BIPOC groups of clinicians who can meet together and talk about the very stressors that you experience in doing this work, because there are unique stressors, right? It is different and it is unique. And so getting with a community of people who understand that and where you can really talk about that and have a space to air that and process some of that. Certainly we can do that in therapy, our own therapy, but I think it's very powerful, right, to be with other BIPOC clinicians who are feeling that and experiencing that and know what that is and supporting each other in that as well. So there's multiple different pathways, and honestly, working in each of those is going to be the best, right? If we go back to that idea of comprehensive strategies, we want to really have, you know, build in redundancy in that regard.
Well, and I think too, as clinicians who are not people of color, it is important for us to support our colleagues who are BIPOC and ensure that we are reaching out to them and checking in on them. How are you doing? What can I do? And making it okay to have open conversations.
Absolutely. So, and for us, related to that, for us really also to recognize, and as you say, be willing to listen, be willing to
Yes.
really be open and say, well, what is it like for you? And as you say, what can I do?
Right.
Yeah.
Right. Yeah, I would refer people to, we have a series called We Hold These Truths. We did it in the late fall into December. And part one of We Hold These Truths does talk about trauma and the intersectionality of trauma and the ongoing events. And so that is available on our website for free to our policyholders. It's part one. Dr. Keisha Holden and Dr. Brenda Ingram were the two presenters. So that might provide some additional support and information. So here's another question. Can you explain more about self-regulation?
Mm-hmm. Okay, yes. I didn't know if there was more to the question. So self-regulation, again, there's probably different perspectives on this, but in terms of how I was talking about it in the literature I was referring to, it's really about regulating some of our, physiological responses to stress. As we all know, stress impacts our body. It can raise blood pressure. It can make us anxious and jittery. And so some of the self-regulation is going to be aimed at regulating that impact. So sometimes that's meditation, maybe yoga, but even just those brief pauses where we just sort of close our eyes and do even just 2 minutes of deep breathing. That in and of itself is a form of self-regulation. Those built-in pauses, and they actually, I know it sounds really easy, and sometimes I think for people it sounds sort of silly, like, what do you mean I'm going to go do breathing? Are you kidding? And yet breathing, actually, it can have a profound impact on our body, and can really change things. So that's really what those kinds of things is what I was talking about in terms of self-regulation.
And there are numerous strategies in the literature about self-regulation techniques you can use while in a session. If you are feeling like you're about to be pulled in, some simple ones like pressing your toes against the bottom of your shoes and thinking about what does that feel like, or what 5 things can you think of, see, smell, hear at the time to kind of ground you while you are in that kind of whirlwind that might be unbalancing. So certainly
Right.
A lot, yes. How does stress alter our thinking?
How does it not alter our thinking? It can impact, first of all, so that's going to be very individualized what it will turn into for you or for me. But the more stress we're under, we can start to tell ourselves we're stressed. We can start to sort of buy into certain ideas about what stress means and what stress impacts for us. And, oh, I can't do this, I'm too stressed, or I've got too much to do, or I can't possibly do that because of blah, 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 blah. And we box ourselves in, and we do it sort of cognitively, and oftentimes we do it without knowing it. But the more stress is there and there and there, sort of constantly there, we also forget what it's like to not be stressed. And we forget what it's like for our brains to work and function without that level of stress. And so we sort of, and that's where, again, taking these pauses, trying to find these moments where we can step back a little bit, put a pause on that stress so we can remember that other state. That can help some with the cognitive changes, right? Because it will over time change the way we start to think about ourselves and the world.
Right. Very good. I think we have time for one more.
Yeah, exactly. I was going to say that too, because I do have one more slide at the end that I'll talk about.
Okay. Yeah. So what if we cannot identify strategies for self-care that are nourishing? For example, nothing feels nourishing and we are socially isolated due to the pandemic.
Excellent question. And yeah, I think this happens to a lot of folks. Sometimes I think it's, especially when we've gotten sort of so far away from ourselves that we don't even fully know what nourishes ourselves anymore, right? Because there's just so much of this, a little like I said. But I think then the task really becomes sort of experimenting or playing with and trying things out. Because you know, that may, in some ways, if nothing feels nourishing, that can be a sign in and of itself that we're in a place of either burnout or depression or those kinds of things. And so we want to, when we notice that, we really want to tune in. We may need to, you know, seek out some of our own work, our own therapeutic work, to do some exploration of that, or just experimenting with things. But certainly I'll say, you know, now in the pandemic, it is, I think, especially hard because it's harder to do some of the things that might be nourishing, right? Like getting out with your friends or those
Right.
kinds of things. And so I think to some extent, we're all doing the best we can, but reaching out and talking with people, even about that, will start to hopefully open something up.